Okay, on a kusha on a cabo. Once again, welcome to the Bodi Bεttεh Gentri program. When a salon people them, we don't learn book in medicine and they bring this program to una. Me not a medical doctor, I'm not any medical background. Me na name John Fuller, me na business IT consultant, me na cybersecurity professional. So me na like most of una we not get any clue in which any guy they talk. Me na one pardon. Okay. The responsibility now is for hosts and also for ensure say I manage the team for the able bring them program there to now uninterrupted. Okay. Today na the 87th session for una we don't join me before. Una gonna say we don't run now for over 5 years. Today we talk about shingles. I forget Ronsho, I forget O at the end. Basically this now something we for me it is close. We have been there about 4 or 5-ish. Something like this be happen to me brother wherein in the morning we wake up and get some kind of rash now in waist. Then say that because in yala because brother in yala me dark. I guess now me not the final version. Joking. Now I get with my face. Maybe are different. Anyways, he wake up in the morning, he gets this them rash there now in waist. They say that Ronsho na hug him. They say because in yala me dark in the Ronsho like. So today we can understand the myths and stuff like that as to which that in the why they happen and how you for prevent yourself against them. Okay. So now we do today is Sunday the 25th of October 2025. And Dr. Mohamed today, now they present to me today. In go tell now a background and waiting, you go do into introduction. And like I said before, my name is John Fuller. Yes, I can use the John T Fuller because it's easier for let people and call me John. So if somebody call me Timo, I can know see this person will know me personally. Okay, and also yes, Dr. Turday they present, but we get a panel of other doctors. Then we specialize in various areas. Then we be at hand for support. Do you have a fumble them? I get for give a short disclaimer. We not then I have to give personalized advice, which means if you come with your own personal case, we're not going to answer that kind of question. Not to say we'll not go sabi. But the problem is everybody in situation different. We'll not get to a medical background, test and result and whatever like that, we'll not get. So for now, we can give a medical advice, based on we'll not get anything in it will be wrong of we. However, if you meet me personally, in some cases, yes, the doctors then will be able to pass some general advice. But on this program, a general advice with the give as to what think can normally happen, the various scenarios we'll look at, and what you need to do for prevent and stuff like that. Okay. So like I be say, when people normally come together, we say we want to help people and I make we do the program in Krio. We don't say people not have they don't understand English. Most of them they understand English, but we person they in stress with something they happen. It better let talk to them in Krio for they understand. Okay, and the understanding how they try for enhance. So we not they get paid. We only bring discount on a free of charge. So we do workshop and stuff like that. And by God part, at some point to the plan say we go dinner salon physically for try for help with people in there. We go look at things like that in future. But also there they ask we continue for play. If anybody gets avenue for this program go on radio or TV, we happy for getting information free. Let them put them on radio and TV, we'll not go charge, we go try as best as we can for give them in the format we want them. Not about money, this not about for we help people them because a lot of people in the suffer and die needlessly for something they way, something they need. That make we bring this to now. Okay. Like I said before, the program the recorded version go there on YouTube and Facebook, and also I can contact you on WhatsApp. Some people in the WhatsApp group already. I will share the WhatsApp group link later. If anybody want to join, feel free for join. You don't need for ask authority for join. You don't need for authority for left. If you did it, you're not happy, you can always left. The group not just place where all man they able post. Now admin somebody able post, i.e. the doctors. Then we only post information when medical information where they feel say pertinent or relevant to we people them. So now they will post there. So not they get their random post or sales post and stuff like that. No, not just in them way important for medical stuff. By God power, by next year, we will begin go back live again on YouTube and Facebook. So for that, they will able to join on Zoom. You can able to join on YouTube and Facebook. But by God power, by January next year, we will begin that day again. Okay. For the one they want to ask question, do you have me family them for una will be joining before I go understand this, but for una where they join now, what we can normally do, we mute everybody. So the person where they present will be able to present uninterrupted. When we're done, when I will get enough time, and I will ample time for to ask any question. And I quite see we get a panel of doctors them and medical professionals them from various backgrounds. We go at least one person within that panel, they will go be able to answer any question we get. Okay. For that, they were comfortable with IT. Most of them they look on a tablet and phones. If you look at the bottom now, so you get three dots there. If you press on that dot there, and this will appear, so you can raise your hand. If you raise your hand that way, they are able to see you and come to you. However, if you not sabi do that day, please feel free for AC you are not physically, I will try for country. But if for AC I'm not physically last year, obviously you camera get for Dion. Dear me family, if you didn't an environment, you're not good for public viewing, do you not turn your camera on because maybe me not go see him, but somebody else might see him. And the problem is if we put them on YouTube, other people then will see him, we're not fine for the program. Okay. If you didn't have environment as well, we know easy dear me family, no turn your mic on for ask questions. Rather type your question. If you want to type question, if you click on this between say chat, you can able to type your questions just like you do on Facebook or on WhatsApp. Then we go read your question out and then go try for answer them. Okay. Like I said before, you can raise your hand up this way or you raise them up physically. Do if I not come to you quick, it not mean say I ignore you, just mean say I not see you. But I will make sure say everybody gets enough time for ask questions. Okay. That's all for me. I don't see me fine face. Now they can't handle now to the so the more fine past me, the more land book past me. Dr. Turday, we can take on through the session today. Do you have a family if I get any questions, suggestions, or feedback? Feel free for email me or talk to me on WhatsApp. That number they not call them direct because you never go through now only on WhatsApp, you will talk to me. And if you call them, most likely I'm not going to pick up because most of the time I'm busy. But if I see a missed call, I will try back forget to you. Not means I ignore you, but I will try to get back to you. But without further ado, I will left now to in the capable hands of Dr. Turday. Thank you very much. Speak to you soon. Bye.
Okay, thank you. Thank you so much, Mr. Fuller. Now, do you hear me?
Yes, sir.
All right, good. So, please, I go and ask you unmute everybody.
Yeah, at the moment they're all capable for unmute themselves.
No, when you unmute them all because some might find difficulty for Lego unmute.
Okay, I don't ask they all for unmute.
They all my unmute itself. Just slowly get brief discussion. So, my family meaning Dr. Turday, physician or general practitioner, then working orthopedic surgery, neurosurgery, and other specialties as well. Today we can talk about Ronsho versus Shingles. So, right. So okay. So as I say. Okay. So as I say, today we talk about either Ronsho versus Shingles. So the people that we didn't we don't know about Ronsho, I go ask for let them unmute everybody so that they go share their experience as well. Or if they go tell we waiting and know about the Ronsho because this one for let be kind of interactive session wherein una they talk, myself they talk. I believe say this is a topic we're very common now we community Ronsho. We know more about Ronsho. So these are my credentials, and I also know this now with Bodi Bεttεh past Gentri. So first, I want to start by asking a question to everybody. What you wanna think say na this? Anybody can come up and tell what you think this picture wanna see. So waiting wanna think say nine. Yeah, this picture. What you wanna think? Any idea? Nobody? Everybody on mute?
Yes, Dr. Turday. Me, I want to say what I think say be.
Yes, go. Yeah.
This is an affiliate talk.
Yes.
This is a rash. But I remember when I've been come up as a child, we big people and can always say this na Ronsho. They say na Ronsho brings me to the person or na Ronsho touch am. Now until I go into nursing now, I can't know for say not to Ronsho na other thing. So that's the number I go tell you say I know.
Okay, so it looks like Ronsho. Firstly, I want to mention to the people I forget for mention, say this program will do one because one of our listener suggests for law we do this session. Let me with the do one. And this shows we respond to una request as we always ask. Anything now for law we present, law we talk about, now we talk about. So we able a listener kindly request that we do this session here, talk about Ronsho, and make we talk about this wire. So and Nafi, don't give your own suggestion. Anybody again? How about this wire? Anybody get any idea now waiting?
It look like Ronshoo na Malania.
Okay, okay, that's good. Any other opinion? How about this one? This one look like saying a white person. I don't know if insef will show Malania. Any opinion? Okay. Nobody not choose for say anything.
I think that white man you go Africa.
Okay. Okay, you go to Africa, so tonight make. Okay, well,
Yeah.
let's see. Okay. And how about this one? Is it the same or different, or any opinion here? So ask follow on mute so that we all will talk, we'll talk together, because I'm sure Ronsho very common. No, I hardly go say anybody in a Saloe we go say say at least the word Ronsho they exist.
No, they are not to this and call like.
Okay. Well,
so and this why it won't look different because the one like balagba not to like what you they call na yeah, they are the way can get eczema. Not in they call like balagba back.
Okay, all right.
Now the same as Coco.
Na ringworm. I think the lagwa na ringworm na they call her.
Oh, na is it? Okay.
Yeah, na ringworm.
Oh yes, na ringworm, yes, lagba. No, cocoa different. This also cocoa this.
Okay, all right. Where this wire now? This looks like it's possible.
That's a bad one.
Okay. That's good. Okay. So what about this one? So
wow.
you get black person, you get white person. So let's see. We'll see now. What do they think?
I think say this not just different areas of the body where affected by this Ronsho or shingles.
Okay. Any other opinion?
I me agree with certain first person just say, but I am for caution where they say now wait man get Ronsho, because the virus where they cause so-called Ronsho, they happen any sign of the war, not the chickenpox virus. So you have to take that in consideration. So
okay.
Well, until you say Ronsho na virus they cause Ronsho, we don't know that yet. What we know is that Ronsho in Africa is there. So if this was Mango Africa, and the Ronsho go Malane, but if you look at this picture, for me, it looks like say the Ronsho no Malane the person no na face na touch.
Okay.
Wait till me and the Ronsho get fed with a slapper.
Now so it look like the effects now he box up.
That's good.
Hey, so I believe say Ronsho then get picking adult woman and man.
Okay.
So could it be woman the church different side or picking the church different side or
Yeah, maybe.
This, I think that it's not a Ronsho, because Ronsho is not big like this one. Ronsho like just flat like red iron weight and don't go touch on body.
All right. Okay.
You see, Antinene professional power show business.
To be honest, me I not ever know what it will show look like. So sometimes today I will see what it will show rash
look like. Okay.
for sure.
Okay. Right. How about this one?
I think they don't like the same rash. It just be say they're at different sites
of the body.
sometimes this na slap, not to Malaya.
Ronsho slapper.
Yeah.
Slap. Okay, that's good. Okay, that's all. Thank you. So today, I say I'm glad for this contribution. So we talk about this Ronsho Ronshoo, well, specifically we talk about herpes zoster. Medically, they belong to a same family. If you take all the virus them, you take all the bacteria them, or the bugs the way they affect human being, we group them into different family. So these their own family, then call them the herpes virus family. Now they all belong. Now, studies don't show say you get over 100 types of them, and virus family there of herpes, and of them, they only don't study say 8, 9 they affect human being. All the other one they affect other species, other species, but human being are only 8, 9 specifically they affect human beings. Some of them they affect them through sexual means, some of them not through sexual means, different means, and they affect them. So they grade them from like 1, 2, 3, 4 up to 8. Now they call a human herpes virus. So the human herpes virus 1 and 2, 9 normally then can call herpes simplex. And this one can cause like then wound put they can get sore then at the mouth, na wound na mouth. And people also wake then can get some kind of wound, then painful wound them through them private areas. These are herpes simplex they cause them. Now the human herpes virus 3, now there this herpes zoster or varicella zoster virus belong to. Now the other name for them, human herpes virus 3, where somebody be clearly talk. This same virus here, now they cause chickenpox, now they cause shingles. And you get other one day back where you get Epstein-Barr virus and other different type virus that where they belong to different, from 1 to 8 basically. But when they talk about them today, now this number they talk about. Now the good news is where one let everybody know they happy simplex, it can transmit into sexual means, as opposed to this shingles or chickenpox, not through sexual means passing the transmitter. So if you see somebody get shingles or get Ronshoo, say not to any sexual means, it get that way there. Now, waiting or Ronshoo or shingles, as mentioned, the virus we then call varicella zoster. Varicella, now in they cause the chickenpox, right? And the zoster, again they cause a shingles. So it's the same virus basically. Now they cause chickenpox, now they cause shingles. So the one way it come now to the stage we call shingles, then they call her the herpes zoster virus. Now basically this virus here they affect the nerve, and the nerve where they affect now they are where they supply certain parts by the skin. So the skin get immune distribution we can talk about. So based on the nerve involved, now so that area they get for be affected. It can affect anybody from picking to big person, but mostly now adult and elderly people and people with their immunity really low, now they affect. Now let's take how it happen from chickenpox to this shingles. Now when picking small or anybody get chickenpox, through droplets and things where they get them, I go through in lungs, inhale them or whatever, inhale, I go through in lungs, it multiply there. When multiply there, from there, it go na the skin, it begin form this rash, we can spread all over from head to toe. When the chickenpox they happen pan picking, mostly. After when the rash don't dry and everything, the body don't fight against them. Within the virus they do, they go hide. And then they left the body completely, they go hide. Whose side they go hide? Now one part near the nerve, right? You get the whole spinal cord, and you get one area by the nerve, we then call the ganglia, okay, the dorsal ganglia, and mainly the part of the nerve where it deal with sensation, basically. The ganglia, na they go stay. They hide there, and then they do nothing until they get that opportunity for come out. So waiting they keep them inside day. Now when the person immunity really strong, they make that virus they stay. Just like if you get bad person in a country, like say rebel, when the soldier man, they're always there around, they're afraid they need to come out. But anytime you get an opportunity, say better they fight me, they come out for can cause havoc. So when anything happen, we drop the positive immunity, it come out. And when it come out, it can cause this rash. Okay, can cause this rash what they see. So now, how it come about for can cause this rash specifically? If you take, for instance, within this ganglia, right, the dorsal ganglia, it hide there for long throughout his life. You go there. When the immunity drop, it multiply inside here. Then it travel through the nerve. Now through the nerve, it travel. Then it come na the skin. When it come na the skin, the blisters then can form. So even when you look at the stages, I get the pre-rash stage and the rash stage. Then when the rash can appear, now the virus, the camp and that rash. So at that stage, anybody will touch that rash day. If that person did not don't get chicken pox before, they get chicken pox. So after all that rash day, from the till the rash appear, till the rash they dry up, that thing they become infective. Then after that, when the body don't fight against them, or you don't give medication, we don't calm down the virus then they go back, it go hide side the day. And they go back, it go hide. But that thing they don't cause damage. It cause damage to the nerves then. And at this one, I can lead to people who they get severe pain after when the rash don't heal up. After we don't get the chicken pox or the Ronsho, it get pain long time. And that pain it can be so difficult for deal with, and it is so severe. Right. So this is how it happens. Like you see the virus then it is travel through the nerve, it come there, this is not the skin. It cannot the skin, it can cause this rash. And due to stress and other conditions they happen, they see the air within the skin, they fall off. Where some people they say, oh, we go get Ronsho, we go some side, they say, see, the air they come up and the air they go and everything. The people then get the thing when they tell them, right? But basically we explain waiting the cause for let the air they fall off. And this post here we get this infection here. Now the nerve, like I say, it is affect a specific nerve. You take the human body, it gets the skin of the human body supplied by nerve, and this nerve and then they make it get sensation. Like when somebody touch you, they make even you feel say somebody touch you. When it touch you, it send that information go now the brain for say, hey, this person don't touch me. Then you turn. So, but then area they didn't have the skin, they go get specific nerve they supply, and they only supply in a specific pattern. So you see like this one, this nerve here, they supply this pattern here, like this CL1 cell. All there are C6, 7, 8, and they supply this pattern. They can T8, T3, 4 up to T12. They supply the nerve now this pattern here. So basically, they get specific pattern within the supply. You can have the face back, the nerve there, they get the name where they supply the face, and they supply them in a certain direction. Now they go. And then they go beyond that direction there. In those they say, me, they supply this part of the skin here. Then the back, I supply this part of the skin here. So this is why most of them picture now they see the depend on the nerve where the virus affects now, so that area they become the rash they develop in that area they. So because of that pattern, let's say for instance the rash can affect this sire T8, it can so it can't take that pattern, that long pattern there. So what person is here now, it's like either now somebody now embrace the person, or like we say malane or whatever, or person embrace the person because they get that pattern there. So now then they make them they say, oh, this one are the virus or the Ronsho now don't embrace the person, right? Because of that pattern distribution of the nerve. Now you can see this clearly here. This nerve here, when this one now the virus don't become activated, it affects this nerve here, and the rash with that nerve they supply. These are two nerves there now. You see 1, 2. The rash with that the skin with that nerve they supply, now the rash they develop. So this they see this now the shingles now. So based on this distribution as well, that's what they can even use for diagnosis as well. But you get another atypical presentation as well, which can happen, right? So as we go through, we'll see. So this is basically what we think they happen. Now you see the same pattern here. This pulse here, it don't affect this part of the nerve, so it is see this rash, this blister, whatever they happen this side. Now, what we know so far about this Ronsho, we know say Ronsho now a family and a salon, but we don't know waiting at the incident, how many people are affected in a year and all the rest. We don't get that statistics there. See, and so, but what we know is that in a lifetime, anybody in a lifetime, the chance for they get this shingles or Ronsho about 20 to 30%, and this chance they increase as the person they grow older. For instance, if somebody did less than 50 years, he gets two cases out of 1,000, right? For let it get let's get like 1,000 people with under 50 years, you can get two of them where the chances they for where then will get the shingles. After 50 years, say from 80 years and above, the chances they increase. So you get 11 people out of 1,000 where they will get chance for letting get them. All this has to do with immunity and immunocompromise and comorbidities, other medical conditions that the person gets. Now, according to a study where they do, show say black people them, no they get it show like the white people them. Now almost half of the black people there, they get the risk of them get a half compared to the white people there. So the white people or the Caucasian, then they get will show much more. I mean, according to one study where they publish now the Journal of Infectious Disease, they do a study of like 3,000 people then. Of them 3,000 people in there, 316 of them then get the shingles. Of them, now only 81, like 4.5% now they're black. And the rest, 16% of them now white people. So that they should say, if we talk about Ronsho, that means say the Ronsho maybe they affect the Caucasian much more than the black. But we know say this one are a virus. So the virus now they affects the person. In order for do anything with black magic or demon or whatever it is. And waiting at the prognosis, the outcome if somebody get shingles, one it can self-limiting, it heal up on your own, whether you do something or not. However, when you do something, the chances for let it heal up quicker a day, and also it reduce the chance for like get complications there. We'll get for talk about just now. And the people who go affect, if it affects person, we say a pregnant woman or woman where immunity already drop, that person the chance for let it get complications there is more higher to that person there. And the elderly people are more, as I mentioned, now then when that the Ronsho don't clear up and the shingles don't clear up and the nerve pain can be so much painful for a long time. And then sometimes it can even get infection, other infection like bacteria infection, fungal infection on top of the as well. Now, what thing we need for Noah is that when you don't get one shingles, no mean say you don't get forget again. No. The chances they say you will get them. However, if you get vaccine and other things, it reduce that chances there. Yeah. Now, for let Ronsho specifically go come say it lead to death, a very rare. It happen, but very rare. Now, waiting at the risk for let person get shingles. One, age as you grow old, as I mentioned, the chance they high. Two, if your immunity drop, as I mentioned, waiting at the thing they reduce the immunity, certain sickness, and the people will get HIV, for instance, or you get cancer, certain cancer, and the way they drop your immunity, or you depend certain medications, then cancer medications, the way they drop your immunity. If you depend like then steroid medication, and for long time, not for short time, but for long time, back they happen, it drop your immunity. And I think it must fine for what we know say again, stress of any form, studies don't show say it can provoke this shingles or Ronsho. Let's say for instance in a country wherein you get finance poverty and all the rest, financial stress they pan people them, then they provoke shingles. So that probably go begin for ask you question why would they see so much of this in developing country, in more poor economic country them. And also somebody they enable work, it just depend on people them, able for do things on your own, all them things, and they lead studies also say it they provoke for let person get the shingle. Yeah. And also people who then can get studies on show say back the link to and if you compare man and woman get more chance for get shingles or than man, and somebody will get other comorbidities like diabetes, kidney problem, SLE, lung disease, inflammatory bowel disease or depression, rheumatoid arthritis, all that medical condition, and the chances for you get shingles or Ronsho is it's higher than possibly not get the one in the. Waiting at the signs the way they get. First, you get the prodrome stage or the pre-rash stage, where into that pain no more you they get first. The skin they become sensitive. One part by your skin they become sensitive, and they get pain. And sometimes the pain can so severe that it affect your sleep. Like I mentioned before, when the virus they travel through the nerve and all that thing, it get because the nerve they go through, they inflame the nerve, they get that pain day, and your skin sensation they change. And it gets to the stage now when the virus don't travel kind of the skin, the rash begin appear. They appear like a small something like one small bump no more. You will ignore them first, then before 3 days they see the bump they begin increase. The bump they increase in size. When increase in size, then water go inside it. And water go inside it, sometimes they even pus, they go inside it. And that rash they can be so painful, and then it can last for some time. It can be up to 2 to 4 weeks, it can continue, or it can be less than that. It depends on the person, our immunity day, basically. Then the rash eventually it can heal for person where get good immunity, and some people and they they heal quick. It take very long time, mainly in elderly people and people who get poor immunity. And one thing I need for mention again say, not apart from that pattern where I don't tell you say it happen, it get a typical presentation, okay, even difficult for even clinician and diagnose, because they take that pattern way you will look at the skin, it appear in another way. We will see with time we will see different pictures about them. Then in addition to that, some people they can get fever, headache, tired, feel unwell, all that in a signs then where they should say na shingles you get. Now I want to mention back say you no go get shingles from somebody where get shingles or chicken pox, right? You no go get shingles from somebody where, let me say, the person don't get chicken pox or shingles. However, the person will not ever get chicken pox, he can contact with somebody who get shingles, that person they get chicken pox. Okay, so makes thinking advice say person if avoid people away then they immunocompromised and all the rest. Waiting they happen because the rash now the virus they up until that rash they dry, that person they get chances anybody touch that rash they get that a chance for let it will get and chicken pox from that person they. Right. Now, what are the complications that we possibly get? When person don't get shingles, the nerve don't become damaged. Now that really cause the pain, and that pain can last for up to 3 months or more. And for managers, I don't mention, it can difficult for manage. The other one, it affects the eye. The other, it affects the ace or the other infections. So we'll talk about the one by one of the one there. Now, the one where they affect the nerve, like this person, I don't get this rash, the early stage. The rash don't dilate, I don't dry and everything. It don't damage the nerve. The pain, they continue. The pain can be so burning, like stabby, itchy, it can be on and off, or it continue throughout, this now because don't damage the nerve. I don't talk this multiple times because you don't damage the nerve. Now, what we can do for this one, things then the way you can do for help yourself. Like say if you say that area the rational the day you get they wear close way now like cotton or silk clothes the way they irritate that skin day, right? So you wear things close the way they irritate the skin. like, okay. And also if you get like anything to protect that area of that skin day, you know, you can put like bandage over there, you know, clothes where you can compress them so that other things no will touch and over them. Or if you get like small plaster, you know, you can put the plaster over that area there with that plaster they cover them, because the person, anybody will touch that thing there, or sometimes that thing close or thing touch and say it cause the pain and it stop you for sleep. You know, it can use like cold packs them, all the things and then I think we can do for help. If that did not help, medication the way they take, it start from, it depends on how the pain time. If not mild pain, you can just take paracetamol. That's if not good medication or good paracetamol, you take them or codeine. If it don't become severe, you get what they call neuropathic medications, them where the person can take. You know, things like gabapentin, amitriptyline. Amitriptyline very good because if you take an anet, more like you take an anet, it help you for sleep back as a part of side effect. Pregabalin and all. However, some of them medication, I take them for long time, get their own consequences where you need for deal with your clinician or doctor for let it will help you for how you for manage your pain. So I'm thinking that the pain can be so difficult, medication or they help, you know. Things like tramadol, okay, help. No, then they sell them beaucoup now na salon. But if you want to take tramadol, we advise you for you meet a specialist, because natiwe can lead to addiction. It can lead to addiction. So you know they take that long, so you need for talk with a specialist. If then they did not work, then get some plasters them. When na lidocaine or anesthetic plasters them, where they put na the area outside the you get the pain. One kind of patch or even the cream day, what they call capsaicin cream, where if you buy like pepper, so it they rub and force, it they get in ignite the pain after some times, it help. Then if then they all no help, then could go to you can do nerve and block where they go do injection and they inject that nerve day where the virus will affect, and inject them either sometimes with steroid or some other medication there, we go act as anti-inflammatory, we will help for calm down the pain where they get, or they do the Botox injection and then TENS machine like user. So different way. So because of this pain can be so bad, most times sometimes they would refer the people to the pain management team, where then they go through how for go how for manage the pain. Now this picture I'll be showing at this picture. Waiting at this picture, when I see this man here, na a specific area, now they get this rash. Now, this area, when it get this rash, that an area with the nerve, the supply towards the eye area. So they call them shingles apizusta ophthalmicus. Basically, now the shingle way they involve the nerve with the supply the face to the eye. If you see this man, himself, he gets that same presentation. I'll be showing at this picture earlier. Now, waiting they happen here. Get this nerve here, what they call the trigeminal nerve. It divides into 3 branches there. Like this green area, now the branch where they call it the ophthalmic branch, ophthalmic nerve branch, where they supply this particular part, this green side. So now make you see that man in picture. This picture we'll see now. This side we'll see now. Now because of this green area, this nerve now don't involve. Now, this can be dangerous, like information. It been dangerous when somebody gets shingles where they affect this area. It can be dangerous. We can normally advise the person, say they need for treat them quickly. You need for waste time. You don't need for waste time with them. And mainly, if you go meet a doctor, then go to they call the Hutchinson sign, where you can develop like rash at the tip of your nose. That they should say it don't affect the side way. It will get for later on danger to the nerve, to the eye. Now, if you involve this branch here with a maxillary branch, you see this area where you see purple, so now they rash develop. Or if you involve this area on the mandibular branch, now it involve this area here, where you see so this blue area. So it depends which area, which of the nerve we infect, now that way the rash they appear on the skin. Right. So you see this man here now, outside the rash appear to him because it involve this area here, this nerve here. So involve them, so you see you get presentation of that kind with it. Now, when they all involve this part of the face, you see this man here, out the eye. Now, just one part involved, this other part in okay. So again, you see this, it can affect the eye. It can, if they not treat this, it will lead to fatal consequences, which will lead to eventually blindness. It can lead to blindness, like I mentioned, it lead to blindness if they're not treated quickly. So if somebody get this kind of rash, it not go to the right person, it go to somebody that black magic or whatever, make them treat the virus with the inside the nerve and everything, it lead to blindness. So who that first for contact? Now the ophthalmologist, the doctor of the eye. They get for him because he get for involved in the ongoing care of this person for saving the eye. Sometimes the medication they give, they get for get through the vein, not through tablets no more. They can get for get through the vein, and sometimes it can take for a long time. And sometimes they then could even need for the operation. It depends of how far it will affect the eye. This now another complication where the nerve, the rash don't appear now this side, the shingles Sunday. They on top of the shingles, you know, a virus, then bacteria don't come on top of it. So this complication will become more, then people away then get shingles or Ronsho, they go meet somebody where they take leaf or whatever they put on the, and on top of the skin get bugs, and you don't get an area where the skin exposed, it will lead to a bacterial infection. This bacterial infection will lead to so many things: cellulitis, sepsis, and even death if they not treat them quickly and properly. So this is why I not only need to get the antivirus medication, you need to get antibacterial medication as well for treatment. Sometimes it for be through the vein. It depends on how far the infection don't go. Like this one, now that same ophthalmicus happen, but this one made they not treat them quick. It don't either they don't go put leaf or that tympanum, then it don't can get spores now. It don't can get bacterial infection on top of it. And when it happen at the aid, we know the communication, the aid to the brain and everything, this can lead to fatal consequences or death. Now, if the rash don't heal up, the other thing that happen, some people then they get scarring. You see, this person don't get the rash, it don't heal up, but then the scars this way they happen after them. So these are the complications them which can happen with shingles. The other complication that happen, we call them where the shingles that affect a nerve, what they call the facial nerve, and it even affects to going towards the ace. The color apizusta oticus, which involve the ace. We see the develop rash na ace, right? We call it Ramsey-Hunt syndrome, right? This one is similar than the medical name for the medical professionals around who they listen. We call it Ramsey-Hunt syndrome, but again another condition what they call like Bell's palsy, where if the presentation somehow similar. The way you go able to differentiate them now sometimes when you get this rash now, and also the pain where the person they get. So the rash now the ace, all intend they make the person, they know say the doctor they know say this one Ramsey-Hunt syndrome you get or Bell's palsy. And some people like even because of the similarity as well of the clinical presentation, even facing a stroke they get because they supply you expression on your face for let you smile, let you wink, you wrinkle your eye, your eye and all them things, and they move your eye. Now that nerve day. So if the nerve don't, in fact, they see they get droop in the face, they sag this eye. Would this side look fine? That side they sag, the eye they close properly. Or where people can see that they normally patient they can run can facing a stroke, they don't get any rush or can in a clinic or a hospital because of this one, yeah. And when you examine, say not get the other features them of stroke. And again, you get for distinction from just Ramsey-Hunt syndrome and Bell's palsy. The clinicians and then go know, your doctor go know how to distinguish them because they're very similar. Some people and they can get this Ramsey-Hunt without rash, not just pain no more. Then they make it even more difficult for diagnose. Now, when you get the waiting we know about them, not common that much, like 5 out of 100,000 people then they get that kind of shingles. They get pain inside your ace, they get rash, and sometimes they get ringing at the ace. They feel dizzy. They feel like you're in a boat. You get weakness in your face, And again, then get for different. I don't mention, but the eye they differentiate with the Bell's palsy. You see, the outcome for Bell's palsy alone is better than this Ramsey Hunt. The treatment normally they can give antiviral medication, we can talk about, or they give you steroid. Again for major. The other one, yeah, I know they close, they can give some kind of pad and lubricants na eye so that something will affect your eye. How we diagnose them? Mostly how the person they present, how the rash they present, the skin sensation, the kind parts of the skin we involve, the distribution, and also if you get certain things like fever, headache, tiredness, then they look into them. Clinically, some thinking they can difficult because they can get a typical presentation and where you just clinically normal, they're able for Sunday. Most of the time, you don't need for do lab test, but in some cases, you need for do lab test. You can need for do swabs and culture, and you need for take blood test for go to the lab. Let them go see if the virus, they look for the virus or the it's SF before they go able for diagnose them. Now, how will they affect the ear? When somebody they get shingles or she will show you say the ear they for them. If they catch the area, it damage the ear follicle, it cause the ear for fallout. And you get what they call alopecia, where the rash, the single rash, the shingles in rash, they damage the follicles, the growth, the root side the ear they go, they damage her. Yeah, it damage her. So then they lead to the person they lose ear, sometimes temporal, sometimes permanent. They get a condition wherein, due to the stress of the skin, it make the person in the ear follicle, the growth of the ear, they go to a phase what they call the telogen phase. It cease for growth. They notice that they until 2 to 3 months later, when that phase they don't go, we can get supply to the base of the air. Now that thing is the air they fall out. You get that affected 2 to 3 months after the air they fall out. However, this is not temporal thing. A ear can grow back. We call that telogen effluvium. For the medical people already now. So you get that kind of phase the way they happen as well. Then the medication they give, some thinking if you take them for a long time, it can affect the ear follicle as well. So this is not the reason they will make the ear they fall off when somebody gets shingles. How will they able to prevent them? We get vaccines so they take. Prevention is better than cure. First, then they use Zostavax vaccine, when like the part of the live virus, they use. It good, but nowadays they don't get a new vaccine where now the dead part of the virus that they usually call Shingles vaccine, where it give to people even from 50 years and above. It help for possibly for leg get that pain, we get the shingles for leg get that pain. When they persist for long, it help for reduce the chances of that happening. The Shingles vaccine, now 2 doses you take. The first dose we don't take them, you get for wait for like 2 months to 6 months for like take another one. But then at the possible immunity drop. But possible immunity good now for 6 months onwards. Every country get your own protocol how they go about them. Yeah, so it can help for prevent person for like get the vaccine or like get the shingles. They get 100% cure, but at least they reduce the chances. And studies don't show say the shingles vaccine is more better, it give more less severe cases them than the Zostavax will be there before. It not get better side effects them basically, like any vaccine or inside they inject you, they get pain there. Now, waiting at the treatment, we don't talk about antiviral, now the key, now you get different type of antiviral medication, acyclovir, valacyclovir, and famciclovir. The valacyclovir and famciclovir are the one the way the studies don't show the way you take them, it reduce the chances for them other complications they always we don't talk about just now. And what they do is manage the pain. I don't talk about the pain like how we talk about the pain where the person get that shingles where they involve the face, how we treat them. Pain medication, paracetamol, ibuprofen, and all the medication. But most times, they want they work, and we need for take then neuropathic medication and then cream the what we don't talk about. Now, using steroid a controversial between clinicians, and some say you use them, some say you know they use them, but it depends on the clinician. When I will talk about that day. Now, the things that way you can do where you don't get shingles, we they advise you like avoid for touch the rash. Yeah, there you make sure you protect the rash, let it not touch other person, because other person will get, you know, the virus, they will get and chickenpox and all the rest when you expose them to Peking and elderly people. Then, if you know say it is something we able for cover, like it in a trunk, na you chest and every able for cover, you can go work. It depends on the type of job we they do. But if you know say it in a side where you know able for cover, we advise say let not work until that rash they don't dry. If then try not for share towel to other person, then avoid for scratch the rash. You wash your hand frequently. You know, if the rash they you know they pull water, you cover them, and you wear clothes the way you know say it lose, you know they irritate the rash, and then for you know I don't know if that they happen still, but first then when somebody gets so foot, then they take the medicine like capsule, then they pull on and put the antibiotics over them. We not advise that at all for put direct antibiotics over the thing, and you or for let use hard dressing them over the rash where they whip, you know, you get for allow and let it dry, and so that you know cause irritation, allow for let it dry, and avoid for touch them, because now they get infection in the kind of picture we don't talk before, you know, and then you avoid for going to school or for work if you know say able for cover the rash. Now, finally, low can through then picture there again. Everybody can give what you think now. Now this after all what we don't talk. What you think now this? I think Nafibi mentioned say it look like I don't know this na shingles or not. What you think? What you think now about when we don't get who don't after all who don't talk? What you think now? What you think say that this rash is? Anybody? Hello? Hello?
Shingles.
Yeah, that's the for muted.
Okay, yeah, everybody can mute yourself. Now, just like final stage, they'll just want to go through the picture there. Let's see if we're able to remember all the two we don't talk.
Shingles.
Shingles. Okay, this one?
It's a
shingles, yes. Okay, how about this one now? This one, we get some doubt about say na shingles or not to shingles.
It's a shingles. This is not shingles.
Yeah, so if you see this post here, I see the nerve distribution, Naya. That don't tell you say Naya because of the pattern in which it distributed. With this wire.
It's not shingles.
Any other idea? Yes, Dr. Patrick Coker.
Actually, one small comment I want to make. I think your presentation was fantastic. I mean, not only the contents, but the fact that you're able to do it in Krio, and I can be the big problem when we get a kind of program here. But one of the things I think say you left out, where for me, I think say very significant, both for doctors and lay people them in the diagnosis of whatever I call social shingles or Ronsho, now that it only happens one half of the body. I mean, I can tell maybe I say midline front, midline back, it will be either right or left. You know, they be right and left together. If the rash cross the midline, then 90%, 95% not a shingles. Where if people can get that in mind, it make them a lot easier for make the diagnosis. Now, this picture where you show so now, I don't know what's in the bottom. If that's not part of, can it not look too clear? The top one, of course, I mean, classic. You can see a midline at the chest, go to the right-hand side.
Yes, yeah, you're quite right. Of course, that midline presentation, like I'll be talk, the nerve, depend on the nerve distribution. All line they get for talk about the, you know, the midline or not. Of what you get disseminated shingles as well, and you get atypical presentations. So just need for be aware of that. Yes, you're right. This wire actually now a healed shingles, where end up forget hypertrophic scar. This is what we see. So hypertrophic scar, like keloid. You don't get so. After we don't heal up, it gets this keloid there. You see, you get this keloid because these are all these scars that we people get after you don't get shingles. Where this other one, yeah.
Shingles.
Yes, exactly. You see how it distribution be. And this wire, this ain't quite evident now, isn't it?
Yeah.
It's
not shingles.
And the same as this one. Okay. Now this one, how about this one? What do we think? Now let's give you a background. This now a patient where one get HIV, two get alcoholic cirrhosis due to alcohol in liver, get problems. It developed this rash in knee area, a small rash. Then we begin see multiple one they come, na different side them, begin to go wild. They do all kind of tests, pana. Do blood test for check other things, them check other viruses, even happy simplex, PCR a negative. Now the only test we didn't do, they do the PCR for varicella zoster, 9 camas positive. So this one a typical presentation because of the policy of immunity, it affects different dermatomes and different skins area. You get multiple presentations there. So basically, not to just the regular pattern what they see, it get a typical disseminated shingles. 90% get. So it's not a case where them present one of the journals then. So this they should say, yes, although we get that normal pattern, you get another abnormal pattern where you need, apart from the clinical presentation, you need laboratory tests for help. This wire, we don't see this wire. What do we think of this?
Now the shingles, the nerve way affects to
exactly. Very good, very good. They affect the nerve where they lead to that. So with this wire, we will get what will they do? Let's say, for instance, you see person get this, I will advise you we will get the person. Now that we don't listen to this session here, if you see person get this kind of, who's advice you will get? You will say, let
go straight to the ophthalmology and then.
Yes. Very good. Thank you so much. It's straight away need for go to hospital. It's straight away need for let no go na corner side. Let them go keeping put things in pana because it need for get treatment straight away because it lead to blindness. This wire, finally, these are the final picture. What do you think about this again? That's the nerve way supply. The nerve way involved as well. Like how Dr. Kokabi talk. Midline, it depends just one side of the body they affected. It's just like this mania. So we tell you all thank you for our participation and today, as we always say, well, Bodi Bεttεh pass Gentri. We want to say thanks to the possible ask we follow do this presentation here. We do this presentation based on the request of one of the audience. So any other session now follow we go do them for now. So okay, stop. So for now, I tell you all thank you, and I ask for contributions and suggestion and discussion. Tell you all thank you.
I get a question.
Yes.
My question is, how long does the vaccine of shingles stays in your body? Like when you get tetanus, usually like you say after 10 years, you repeat them. And so for the shingle, does it have any longevity time, or once you get it first, that's it?
Yeah. Well, it can take up to 2 to 6 years, very basically, but not to forever. Not to forever. It can remain active for like 6 to 10 years or so, according to some story. Not more the Shingles vaccine. It take that long.
Okay, thank you.
Thank you so much, Dr. Tuye. Me fumble them as soon as I don't begin the question session already. You know, the professional on the Ronsho.
Unfortunately, I know some, well, I do small medical DNA business, but no, I am not a professional in the medical. I just, because I'm just about within this area, small, touch now. In those days when I was in England, Dr. Osusu, this is Nene from America.
You don't need introducing.
Wait. Dr. Susue. Right, I'll go mark down it down.
I know Dr. Coca too. Dr. Coca too. All of them there.
Don't worry, and I keep that at the back. Don't worry about it. I promise you. Don't worry.
It's okay. It's okay.
Okay, my family. Well, thank you very much for joining. Now it's an opportunity now for una self ask questions. Because we're not going to let people jump in anyhow. We're going to see you ace you on, or either you do them virtually or you ace them up physically. If you have, or you can send message in the chat. I'm not saying anybody don't send anything yet. I'll just check my phone because someone can send them privately. See, okay, I'm not getting nothing yet. Okay, so Dr. Today. Oh yes, Dr. Coca. Yes, sir.
Yeah. Sorry. I really can't help congratulating Doc for the presentation, but it's such a topic where interests me, and I mean I've had it right through my family medicine clinics. Now I just want to written a Dr. Ion experience in the few things them. One, for me, the younger the person, the more likely for and forget pre-eruption pain. In other words, if they get the pain, you know, they even know what to do. I mean, my worst experience now in those days of whether they do IVP for renal colic or renal stone, whereby I don't see the patient 1 day, 2 day, 3 day, 4 day, this pain, the monogram, no rash, nothing. We do IVP, we bring the result come. I examine and back to that, and they begin to see the bump. Then it developed to full-blown zoster. But over the years, I noticed that the younger people, the younger age group, you know, more the 30s and below, then tend to get the pain, then the rash. Then by the time they get the rash, the pain subside. The older people, like the other way around, then they tend to get the rash first and wonder, waiting this year, so where they call you, make your diagnosis. Then after the rash, now in the pain more severe. I don't know what in a doctor and your own view about that. If I can just ask one other quick question. If you get any experience with family, bunch of we get all them different reasons they all can say, you know, immune depressed, etc. I know of one, I don't get 2 different families now where virtually all the members of the family at some point in time don't get zoster. In fact, the one family where now by accident I find out if say more than one person don't get them, then all of a sudden just last year one other one in the 70 year just developed zoster. So that's the one that again written a document experience. Sorry, I don't want to take too much time.
Yeah, thank you so much, Dr. Coca. That experience, of course, when we talk, so we don't see them, but mostly the elderly people that we can see mostly, you know, with the with this zoster. Some of them they can come with rash, as you say, mostly a rash more than they come with force. But you get half of them back with the car when I just pain. And like that way you explain, so somebody will get you know, stones, it make even more difficult, you know, for diagnosis, because of course you get the pain with the renal colic, and with that pattern area we get affect as well. But the elderly people then can come with the rash mostly. Like 2/3 of them, like 1/3 of them will come with just the the skin sensation. The middle age, 50 and less, then can come with more that skin sensation, and you can only know mostly then we don't get them before, because when they get to the pre-rash stage with that skin sensation, then they get the rash. Then when the subsequent one they come, then kid already know them because of their previous experience. Because of now younger people learning they on so many medication, some they're young so they don't get diabetes, the young don't get this, so they see this they happen more with even the middle age and younger people, but mostly the elderly people and people with they in the when they get the cancer treatments. We see them more common, more common with them. And the ophthalmicus one, the one more when we don't see most of the time more common, the articles, and very very common, and they can't really more like they could stroke they feel, and some of them they with the that Bell's palsy for distinguish them again. So mostly then the ink can come and it can be so frightening to them until you don't do all the investigation examination before they ease up. But yeah, I agree with what you say. The younger people they can present just like how you mentioned. So
Yeah. Dr. Cook, I hope that it answer your question. Me question I will ask. I see on the slide it been get something for do pregnancy, but I don't think you touch much on them. So maybe I'll get for length. Dr. Bell. Dr. Bell, you didn't have a position for talk. Dr. Bell?
Yes.
Perfect. Yeah,
Hello.
so of this family of viruses here, yeah, which one of them, anyone but then they way pregnant woman can get, and if they get them, waiting it can affect the picking, and if they affect the picking, how they affect them.
Well, first of all, good evening on all everybody, and thanks Dr. Tsue for the wonderful session. Yeah, pregnant women then can get some pregnant women can get the shingles, and if you get shingles during the pregnancy, you know they harm the baby at all, because the virus don't they already inside the body, so they actually affect the baby, and the woman will still get the symptoms then. And then if you need treatment, you can get some antiviral treatment that we can use if you want to use them, because sometimes you don't need for do them, and we know what affect the baby as well. But that is different when it comes to chickenpox. Chickenpox, then they can get detrimental effects also on the pikin as well, and also on the woman. So now make we can always try for make if somebody not don't get chickenpox before and if they try for get pregnant, we always advise them for making get the vaccine before you get pregnant. But
okay,
if not shingles, then they they affect the baby.
Okay, so what about if the mama gets shingles where the picking unborn, it allowed for breastfeed? It get any effect on them as well? Or it's fine, just like how we get belly, there's no problem.
With the breastfeed, no, if you get shingles and in the breastfeed, you can still breastfeed. Because as Dr. Tsue don't talk, the shingles they affect that only in that area, that particular nerve area, and you know what like the milk. So it allowed for breastfeed if you get shingles. Chickenpox are different area, a different situation, but for shingles, you can still breastfeed if you get shingles.
Okay. Thank you so much for that answer. Anybody else get any questions? Let's check the chat. No. Okay, no, the answer that in there. That's fine. Yeah. Anybody else get any contribution?
Yeah, we just want I mean, just want to say, in terms of the Guyanese side of things, obviously, to the world's best gynecologist.
Sorry, TJ, you are on mute, Nafi.
Yeah. And I don't mean to say they on because they look about us here. I don't put them as schools to go ask.
First of all, I want to say thank you to all for coming, and to especially Mrs. Kane. When I just did the show, and of course, Dr. Ray don't do a splendid job, superb. Grateful to Ram, and obviously a nice way we respond to a popular request. One of the people that we've been joining and been saying they want for Yeri this particular talk. So I'm glad they say at least one, but we don't get for Duam. It's really, really nice. So this is not just a way forward for Lona. No, say una king request, una can make request, and by God's grace, we will do what you for try and respond to una like how we do so today. Now, in terms of the baby and mommy, risk the day for the mommy and risk the day for the baby. So, risk them for the mommy, as far as I know, it can cause this painful rash, as Dr. Redon said already. It can cause headache and it can cause fever. In very rare cases where not to common, so where the shingles virus scatter, boku, they can get what they call encephalitis or pneumonitis. That is the infection of the lung can happen, and then the infection of the brain itself can happen. And that can sometimes cause confusion from people when they can feel say sometimes the human get eclampsia. And this have now that just big term, but all it means is that any doctor when a gynecologist if you hear about eclampsia, pan woman will get belly, it can worry and then could keep them in the hospital, not only till them born, but even after them born, they can keep them there. So that's one thing where the risk them way there for the mommy. In terms of the baby, well, the one they were just born, the newborn baby them, then they at a very high risk. If the mama get this chicken pox, where nine they turn, shingles later on, just before labor, just before or after delivery. So either before you born the baby or after you born the baby, it's definitely important for we keep in mind that they can happen. And then pikin self can get what they call congenital varicella syndrome, where they get from the mommy in the first 20 weeks. Where the mommy get the belly 20 weeks, is the second trimester, because they divide into 3. So the first, second trimester, 20 weeks, definitely there is that risk as well. And then, of course, important for we prevent the newborn from coming into contact with the mommy when I get the shingles rash, just like how Dr. Turday described them. It is very important for the pikin because everything is still contagious. It still can get infected, and until it dry and crossed over, like you always say, the pikin itself we get them then they school age, they not for go school until then this thing crossed over before they begin go back to school, because at that particular point it's very infectious. So now my own addition than no more.
No, I don't agree. The last time we talk, na me Tifa from. I be just want to ask you, say, if you can get time, how long if you stay at home? And also, the other thing I want to ask is, person we get time, whether not picking or big one, or not, what's the advice with regards to public swimming or things like that, like public activities, where maybe they get from mix with other picking them. What's an advice on that? I don't know if you fall to now, you fall to the public health people, I don't know, but general question.
Everybody. It's the same advice. Once, as long as that rash don't develop, if you're able for cover no go no side. And of course, if you go swim, you will just spread everything. So as long as that rash day na day the thing day. So anything where you think of now where that rash go get contact with other person, or you just try to avoid that. So the swimming and anything, you avoid that day until the rash don't dry.
Okay. Yes, Auntie Nafi.
Yeah, good evening.
Welcome.
As you say, why unmute myself? If I mute myself, I know they will mute again. So
I don't make you co-host, don't worry. So you're good. You're good.
Okay, thank you. So first of all, I want to tell Dr. Thank you for the wonderful presentation. Miss, I don't learn a lot. Some of the things that are refresher for me, some of the things they want to learn in news to me. So thank you so much. I just want to make a quick contribution for remind people and say from waiting Dr. Turday present today. Hopefully we will know now say if somebody get this rash, we'll not for the take and say na Ronsho. This not the layman idea and a salon for where we the small, we come up, people can say, now going to show breeze meat terms, and then say, now going to show touch harm. Well, at least now we don't know, say, now not going to show a virus. Where you go down, they sleep in your body, where you get chicken pox, they don't they sleep until you get the opportunity for showing safe, where immunity drop. So where you get straight now for sick medical help, go hospital. And not forget the public health part where you, if you're able to cover them, like where Dr. Ture say, if you're able to cover and to close the side way, then the body able to cover, for say the chances for like, pass on to other person is slim. But if you're able to cover, if you stay home, you get picking we get and able to cover the rash, let no go school, you self no go work for let expose other people there. Because once they exposed to the shingles virus, you go give them chicken pox if they not been don't get chicken pox before. I just want to add to waiting Dr. Kamara talk about pregnant women. Depending on the stage of pregnancy when they expose, sometimes they get forgiven even immunoglobulin for that shingles day, because of for protect the baby. It depends on the stage of pregnancy within the. So that's not just my contribution. Thank you.
Oh, thank you so much, Auntie Nafi. I hope say you recover well. Thank you so much for the contribution.
Thank you.
Another thing I want to ask. Yes. I don't know how much information we get on the vaccine at all. How is it available and how easy it could be for let people to access it. Know? Anybody know?
Well, for the UK, UK will get
no, Salon. UK will know so we'll go get.
Salon, I don't know. Let them tell me if they will forget them.
Wait, Uncle Doc, call you name, or I just. Yes, Uncle Doc. Go ahead, sir.
No. The vaccine, well, as I say, they work alone and no one day works alone. I think Dr. Coker, they in a better position for tell we about that, really. But important, if at all, they don't get that program, they probably not something for think about because as we can see, although with man, they're more likely for catch these shingles, according to the statistics, we don't hear it. But people we get, the I mean, man or the body don't go to sleep for a bit or maybe weaker because of other sickness when no one say they get. Because as we talk about HIV and all that, one of them, women they will get belly, people they take certain medication, steroids and all that, because they don't know. So that the level at which they get this infection, nobody know because people in the get stigmatized. So when they come forward for let them check them or for let them actually test them for see if they get that or not. And of course, the listen don't do that the body. I see they go now, so they go now, so they cut down, they kill this team where now supposed to protect you. So it's difficult for make we say now this we know, but maybe na important thing that for take in terms of screening versus immunization for trying to give them the maculate where they need as well as for screen. I think then two things and they for go together. I don't know what Dr. Cook and your thoughts on that, but I think it's important for make we actually get this, flag them up. So say, well, that's the way for actually cut things down.
Dr. Kuka?
Don't go.
Let's have a look on the list.
Yeah, I think you don't go.
Don't go. All right, okay. Well, I mean, anyway. But additionally, I want to talk. I don't know something Dr. Ture don't mention me. I mean the drive. So I don't know if I missed that. Apologies for that and forgive me. I just want for let people to know say again. When it affect the face, when these shingles affect the face, like how Dr. Ture talk and say you can get that thing then called Ramsey Hunt and then Bell's palsy and all that. Well, then get another one way similar to stroke, not like a stroke, but when you look at them, you see the person get that Bell's palsy. I've been just want. I think I missed that this one. I don't say you don't talk about that. But the important say then two things can happen. But the person where they examine you, know waiting for look for differentiate that Bell's palsy from that stroke there. And if na stroke, if you say the person get that person, they need to get a scan of his brain. That now one thing I've been just want for clarify. I just see some Dr. Today don't talk about that, but it's important for bear in mind. We within na A&E, na casualty, na emergency, na denting now they deal with how they distinguish one from the other, and when we go decide for do a scan and when not for do a scan and treat just with the steroids and the antiviral treatment them. Thank you so much.
Thank you so much, Dr. Kamara. We fumble them. We don't reach to the half-hour mark. So we can't say goodbye for today. You know, me
Somebody
say
asked a question, eh?
somebody asked question. Oh yes, I don't see the chat. Is it possible to get shingles without never having chickenpox before?
Yeah,
So it's possible to see somebody go get shingles without get chickenpox before?
Yeah, I think one of the slides we mentioned, and they say chickenpox, now they go stay na the nerve and stay there. After that, you get shingles. So if you not
okay, so you can forget chickenpox first before you get
shingles.
shingles.
You not get chickenpox, then you get exposed to pussy where you get the shingles rash. You get chickenpox.
Okay. So like me so now because me I don't remember I don't ever get chickenpox. We Uncle Doc they laugh me, but you never know. I might be one of them lucky ones where I will live my whole life then. I don't get up. You never.
Well, if you not get chickenpox, yes. But chickenpox they catch anybody, even if you're not adult, it can still catch you.
Believe you me, my people, chickenpox in the adult is lethal. Honest to God, not to joke. Chickenpox in the adult is lethal.
So that make it better for go take the vaccine also.
Exactly. Exactly.
Hey.
Very important for take the vaccine. If you don't get chickenpox before you're an adult, go take the vaccine.
Well, I say until I shot, so I go pass for picking. Now I go eating advice. I go eating advice.
The good thing is shingles not a pass from person to person. When you exposed to the shingle blisters or waiting, they get shingles, but you go get chickenpox if you not been on get that before.
Yeah. Yep.
Okay. So if you not been on get that before, you go get chickenpox. But if you don't get chickenpox, what will happen?
Well, you don't get chickenpox from the shingles exposure. You don't get chickenpox. You don't get shingles either.
Ah.
But we only get shingles like where you don't, like where Dr. Today say, immunity drop for whatever reason because you don't get the chickenpox virus, they sleep inside your body now. Where immunity drop, instead take the opportunity to say, well, I go show myself now until the soldier man, they know they work better, Then at that time, they will give you shingles.
No, man, I don't have chickenpox. I think I'll go for do something with that. Again, if I get chickenpox, we're not going to see me for a very long time. Nobody can provoke me.
But the risk they go up as you get older, remember?
Hey, boss, come on. It's going to make it worse now. Like I say no more, me big brother, they say because in Yala, I make it big Ronsho way be small. So sometimes they fine for you black like me. If I'm
this country chickenpox not being notifiable, but very recently they don't make one of the notifiable infections.
Indeed.
Yeah, it not be notifiable.
Indeed, yeah.
Now you notifiable, now you get for tell public health where you diagnose suspect somebody, forget them.
Indeed, yeah.
That's a good information for people to know. That's very good.
Yeah.
If I'm on plenty, thank you for when I don't join we. And like I say, we can wrap up for today. I will ask each of the panelists then for let them just say a very quick take-home message, and we will finish for today. The conversation finish online now, but means that's the end of it. When I get to the number, I will show them again, and like I be promised before, I will put the WhatsApp link for let people join, so you can always talk to me on WhatsApp and ask further questions, or if you get suggestion of another topic, feel free. So I will start with Auntie Nafi. I'll start with you, please. I'll just go by the list where I get now.
Thank you. I want to tell everybody thank you for when I joining, for listening, and thank you to Dr. Turday as well for the great presentation. I want to tell a special thank you to one of our sister when I request this topic for say we talk on them. We ask anybody if you get any topic we want to talk on, feel free for reach out to we and ask we for we do them. And not forget say well Bodi Bεttεh pass Gentri. Thank you.
Thank you very much, Auntie Nafi. I'm Dr. Conte.
Plenty thank you to Dr. Turday for the brilliant presentation. Fambudauna, thank you for joining today. I think we all don't learn say Ronshoo, not a Ronshoo really, but na virus like any other kind virus where they give a problem. So it better let we know. And when we know, we seek advice, we seek medical help in time. then we can able to protect other people. When I think we all know say, well, Bodi Bεttεh pass Gentri. So anytime una wonder we talk about something where we not don't talk it, una know how for pass the message. Una thank you.
Thank you very much, Dr. Rashid. Dr. Angela?
Good afternoon, and Onakuche, Dr. Suri, thank you for that wonderful presentation. Thanks to the audience for the contribution. Dr. Koka, thank you so much for your contribution as well. If I'm spread the word, if people are not able to join, this video will be available on YouTube. We will soon upload them. Then can go watch them. And not forget to say, well, Bodi Bεttεh pass Gentri. No, thank you. Over.
Thank you so much, Dr. Angela. Isata?
Thank you very much, TJ. My colleagues said also everything. I just want to say thank you so much, Dr. Toure, for a wonderful, very educative presentation. And, I just want to say, well, Bodi Bεttεh pass Gentri. Make we all contribute towards this very good cause. Thank you.
Thank you so much, Isata. Auntie Fatmata? HRH.
Good evening, everybody. Dr. Ture, thank you so much. I think everybody don't say exactly what I be want to say. However, I just want to encourage everybody we then at this presentation today for contact with people them in a salon. Let we try for get rid of the myths them where they pass around, especially condition that like the where they cause a lot of health problems then for people them, because if people are not educated about the symptoms and encourage them for let them go hospital where they get certain symptoms, then it will be difficult. And this project here, I call them project, but this now for we people them for let them understand how for identify symptoms and manage them and when for go to doctor. So una thank you, una let we pass the message on to people them. Even if not picture you send, na message did you go, because then go share them all over the place. So thank you so much, Dr. Coker. Thank you, sir. Everybody, God bless. Thank you.
Thank you very much. Dr. Bell?
Yeah, Dr. Tsuge, thank you very much for for the presentation. We have learned a lot. And also concerning not saying me, I always talk about me, woman, they want forget belly and we get belly for protect them as well. As Dr. Kamara said or add, say, the chicken pox. Now, in really gets heavy effects on woman and picking, unborn picking, and also if picking just born. With the shingles, as long as you cover the shingles area, the woman can still breastfeed. But you therefore make sure say that picking they not get in contact with that rash thing. Yes, I one quote today really come to me, really kind of my heart. The quote say a healthy person gets many wishes, a sick person gets only one wish. So we own mission will get now, so now for me we bring and then talk that to people then so that then will not say, well, Bodi Bεttεh pass Gentri.
Thank you very much, Dr. Bell. And Dr. Kamara?
Yeah, well, how you go follow that?
I let that quote say, and I'll go for Tifam. I don't begin.
Yeah. When we start this thing, we don't be feel say we go there like how they so, but it seems as if something they happen, and I'm glad they say the audience don't they rise to we suggestion then. So for me, That's a big plus. And I'm glad they say we don't respond in style. Dr. Turday don't raise the bar, as you see. I enjoy the camaraderie. I enjoy the jocularity, as they call them. It's so good that we need to just talk about sick no more. We can make fun, enjoy ourselves as well. And that's what we do in this program. As I say, Dr. Bell just don't talk and say, if you get well body, well, the wishes that we get, not to one, plenty one. I want money, I want good wealth, I want picking and all that. But if you sick, now one great thing, now they look for. So even if not they below that thing they do for Fenam, we don't call well body, now they do go Fenam. So dear, if you not enjoy today, where I think you now all enjoy, please, and pretty please, when I pass the message on, we want to now for come as plenty as possible so that we will actually pass this word to the other people and let themselves enjoy, especially with people that when they back home, we get this thing where they say pass, if anything happen, now for go, now the corner of Babu, they go get them, then help them, then, Rob we go put by you that in the go, man. Well, I tell you what, I don't see him. And believe me, this is not possibly close to me. Once he get this car, na in neck. When I ask him, he say, na bad breeze, now he meet up na net. And, I don't go into that, but I tell you what, me self no know self for put me face. But that's the thing where, because me now don't get the advantage, I don't go medical school and all that, but as far as I'm concerned, I've been that in there. So I should say, if you know what we do so now today, people definitely don't go hospital before this complication happened to them. And it's so bad because now the place where they show. So now with the shame, you know what I mean? The shame now for show this thing. So now it begin well choker. You know what I mean? So that's the kind of thing that I talk about. So if you look at for this thing in time, we'll get that complication there. But thank you so much, Dr. Ture. Splendid as usual. And all the listeners, especially Mrs. Kanwe just can't today. I sure say you enjoy them. You could call more people in this. I use nick them. Let them come. Dokusus, they na we go help now, and by God's grace, this will continue for flourish, But remember, say, well body, he better pass. All kind of gentry we go get this for. Thank you so much, and God bless you.
Thank you so much, Dr. Kama. Dr. Chule?
Yeah, if people learn, thank you for joining me today. Without una, we're not going to do this program. They basically do it for una. So we tell you all thank you. We're not going to repeat it. Everybody don't say again. Long no say health information. It will go a long way for save life. So whatever information you get now, you don't know that it will be useful too. So pass the information to pass forward the slides or the YouTube audio them, let the person listen and watch. It might answer your question, so we know say well body really na the key, and no wait till we get sick before we see doctor. Let we get the prevention before it reach that stage where they go get the cure. If you know how to get vaccine, na salon, you get way, you can pass on to other people and get that information at the group so that people can go forget it. If you get way for lay, you get again information to anybody as well. Please give that information. So when you tell una thank you, una can join. Do we sessions a one owner, tell people let them tune in, let them listen, please. If you get anybody we get way for go able for air this either na air or na TV or whatever way, we ask una again for una doa. Not for we, but for help the people of Salon. No will give a contribution. So again, if una get any presentation topic on our talk about, we will really for talk about that. So until next time we meet, we will say well Bodi Bεttεh pass Gentri. Until now, thank you for listening. Thank you.
Thank you very much, Dr. Turday. That part we talk about the vaccine is very good. If the vaccine available, vaccine not the cure, not for cure, but not for prevention. It reduce the chances of you getting NTR. So prevention is better than cure. Okay. Not to next person getting kind tear, or if you unfortunately you get them, not to Ronshoo malane you, not to Ronshoo hug you. Go seek medical help. So till we meet again, well Bodi Bεttεh pass Gentri. Good night.